Thank you, David, for that introduction. I'm Debbie Salas-Lopez, Senior Vice President of Community and Population Health here at Northwell Health. In my role here, I work with my team at the community level, and I focus on delivering equitable healthcare access and outcomes for all of the populations we serve. Today, I wanted to have a conversation with leaders of innovation who can share insights into what we as healthcare providers can expect from a technology perspective, and how our work to support health equity, women's health, and environmental health will be supported in the future by leveraging things like digital health, artificial intelligence, and other future-focused technologies. Up first, I'm joined by Aerts of the Novartis Foundation to look at this through a global population health lens. Please introduce yourself and share a brief overview of how Novartis Foundation is focusing on population health outcomes globally by leveraging the power of data, digital technology, AI, and innovation.
Thank you, Debbie, for the invitation. It's a real pleasure to be here with you today. And yes, I am the head of the Novartis Foundation. My name is Aerts, as you said. And what we do specifically at the foundation is looking at how we can tap into the opportunity of data, digital, and AI, the newest technologies we have in our hands today by living in a digital era, how we can use that to advance population health around the world. And the reason why we do that is that even before COVID, the global health challenges were already unprecedented. You have this rapid urbanization that goes together with increasing inequities all around the world. You have an inverse age pyramid with rapidly aging populations that go together. Both of these go together with increasing burdens of chronic diseases, such as cardiovascular disease. And then on top of that, COVID came as a wake-up call that our health systems are really not prepared to address all these challenges. And therefore, it's really essential that we rethink, we reimagine the way we deliver our health and care services around the world. And what better opportunity do we have than using these new technologies? So we take that opportunity in the Novartis Foundation, and we validated an approach that looks at a comprehensive way how you can improve population health, working on the quality of care. Obviously, that's important. Working on the early access to care and access close to where people live, work, and play, but also working with the local authorities to shift their mindset and use data for real-time decision-making, because that's also what was lacking in the era before COVID. COVID is the first epidemic that was so data-driven and made us realize the importance of data. So that approach, in collaboration between the sectors of a city government, can really change a lot of lives. And that's what we do at the Novartis Foundation with our approach that we call Cardio for Cities.
That's wonderful. You know, you referenced the pandemic a few times. And part and parcel of that is the Raise Health Forum. We're focusing on how do we drive systemic change, the kind of changes we saw during the pandemic, right, in healthcare. And emphasizing work around health equity, the role of the environment on our health, treating the specific needs of women's health, as you just referenced. Admittedly, we're somewhat focused on the domestic, the United States conversation. So as you think about those three areas, what is the Novartis Foundation doing at the global level?
Yeah, Debbie, that's really the important question. And in fact, I said our cardio approach is validated. We validated that in the city of Sao Paulo, the city of Dakar, the capital of Senegal, and in Ho Chi Minh City in Vietnam. And what we did is really looking at how data can underpin all the changes in a health system for the long run. And we made it sustainable. In Sao Paulo, for example, in only 1 year of implementation, working on these pillars I mentioned, the care, the access, the reform, the policy reform, data and digital, the I stands for intersectoral collaboration, and the O in cardio stands for local ownership. working in that way has tripled, for example, blood pressure control rates, which is a prime risk factor for cardiovascular disease, as you know, hypertension, and it's very much uncontrolled across all countries in the world. Maybe the US is doing the best in the world, but all other countries can improve a lot. And even in Sao Paulo, we managed to triple blood pressure control rates with such a comprehensive approach in only 1 year of implementation. And that translates itself in a reduction of 14% of strokes in a population of 15 million people. That's a hell of a lot of people you save, or you extend their life in better quality. So it's really an essential part that you do this in a comprehensive way, but to address the inequities, we need to go one step further. And there, what has not been done yet, and what we've now started to do, and we are discussing with North American cities across the US, also across Canada, to bring together the data from the health sector with the data from the social determinants of health sector. So not non-health data, being the environment where people live, the housing, the transport, the food access, all of these different elements that influence your health. You know that the cardiovascular health of a population is influenced by the health system. Yes, it is, but 30 to 40% of it is influenced by the way people live and grow up and work. So we have to understand which are these really big drivers in unequal cardiovascular health outcomes. And that's a new way of working we have taken up at the foundation. Together with Microsoft, our partners, we are reasoning over a combination of these health and non-health data to really identify the drivers in health inequity. And then with that, we can offer cities and the communities within cities nice solutions that can help them make better decisions for the health of their populations.
That's great. Speaking of solutions, right? We think of innovation not only as a hard technology, but it's actually an approach. Whether you're driving unlikely partnerships like what you just talked about with Microsoft, or you're making big bets and more, in what ways do you try to foster the innovation mindset within the Novartis Foundation? And are there principles of innovation embedded in your strategy and approach to improving population health worldwide?
Yes, thank you, Debbie. That's also an interesting question. In fact, our first condition before we will start working somewhere is that we find this political will, this political interest, or the government's interest in changing the way they are doing things for the health of their populations. If there is this interest, and we get that traction, then we will move forward and start partnering with the local city authorities, for example. It's really crucial because without that, any innovation will never reach the scale we desire it to achieve. So that's the first condition for us. And that's the O of the cardio acronym I described before. It's really the most important one. The second one is that every innovation we bring responds to a local priority. So it's not that we come with a ready-made solution that is here, take this solution and scale it up. No, we try to sit down with the local authorities and listen to what their priority needs are. And then develop together and co-create the innovative plan and the innovative way of working for addressing that question. So it's really a co-creation, a co-development part. That is the second condition or principle in our way to innovate the way health and care is delivered around the world. The third one is that every innovation has to have the person, the human at the center. You need to involve the end users of this innovation. And we've seen that throughout our work at the foundation, whether it's in scaling a telemedicine solution throughout the entire country of Ghana, or whether it's implementing an AI-driven chatbot throughout a population in Sao Paulo. You need to really have the end users, whether it's the person or the health worker or the reference center, you need to have them all involved when you design the innovations. And lastly, we've seen that innovations that are designed by local innovators on the ground who know how their population and their colleague people and neighbors are living, who understand that these innovations are the most successful. So that's why we also support local innovations. And we are launching now in October, for example, a new health tech innovation hub in Kigali, the capital city of Rwanda, together with Northwell Foundation. And there we will call a challenge specifically for women entrepreneurs to address the needs of urban populations in cardiovascular health, but also looking at specifically the health for women in those populations, because very often they are very different. And that's what we forget sometimes. So these are a few of the principles we handle in our innovative approach at the Novartis Foundation.
Wow, that's amazing. Local ownership, co-creation, keeping the end user in mind, and supporting local innovation. That's wonderful. Yes. Thank you for sharing today the Novartis Foundation strategy, approach, and the work that you're doing worldwide.
Thank you, Debbie. It was a pleasure.
Next up, I'm pleased to bring in Shez Partovi of Royal Philips and Deena Shakir from Lux Capital. Building off the discussion we have with Anne, we're going to focus in on not only the innovative strategies we're employing, but the technologies that will bring us into the future. Please introduce yourself and share a project or initiative you're working on that might be particularly relevant to the folks in the rooms today, especially people like me who are dedicated to community health and delivering equitable health care outcomes across communities in the United States. Shay?
Thanks, Deb. My name is Shez Partovi, and I'm head of strategy and innovation for Royal Philips. And my role is basically to work on strategy on how we advance the mission that we have, which is to help improve the lives of 2.5 billion people by 2030. And one of the initiatives I could tell, but maybe I'll quickly tell about two very quickly. One is sort of community benefits, and one is around technology. The community program that I love that we're involved in, which is with the U.S. National Minority Equality Forum, and it's really focused on closing discrepancy of care gaps with high-risk individuals and ethnic populations. And we're doing some great work in 4 major cities in the U.S. on basically addressing maternal mortality, particularly in Black women. So that's from a community program. From technology, which I know you want to hear about as well. One of my favorite things is really the mobile obstetric monitoring program. It's a software, it's called MUM. And what that does is allows individuals that are in communities to be able to perform prenatal screening for risk stratification, to sort of do diagnostic assistance, assess patients, pregnant women, for how they're doing in their prenatal program. And so this software is basically enabling community workers anywhere in the US to actually help elevate the quality of care for women that are pregnant. So those are the two things that I think are really terrific, and I'm excited to be involved in them.
And Shez, Deena?
Those are amazing, Shez. We need to talk more about both of those, very much up my alley. So I'm Deena Shakir. I'm a partner at Lux Capital. We're a multi-stage venture capital firm. And I am particularly interested in women's health, as well as health equity and health justice. And a number of my portfolio companies are doing some incredible work in those spaces, including one of our more recent announcements, the Maven Clinic, which is the largest virtual health platform for women and families. And there are some potential partnerships, Shez, I think we should be talking about there as they move more into Medicaid, where more than half of babies in this country are born. I've also invested on behalf of Lux in a company called Aiden Health, which is taking on personalized birth control and really changing the data set, which is one of the most fundamental ways that we can move the needle in women's health, in making sure that women are represented in the research, are represented on the researcher side, and of course are represented around the table with entrepreneurs and founders as well. And so delighted to have invested in both of those companies, as well as a number of others, and continuing to look for the incredible early stage opportunities from extraordinary founders who are taking on these challenges by creating generational companies.
Thank you both. You both talked about important innovations and technologies that are helping society address some disparities. Are things like artificial intelligence and big data analytics able to combat some of the challenges we're seeing in the equitable delivery of healthcare, for instance? Anything along those lines? Deena, I'll start with you.
Yeah, I'm happy to take that one on. I think certainly there is incredible opportunity for AI, for polygenetic testing, for software to help make improvements. But all of us that have been doing this for some time know that it is not only about the technology. When it comes to healthcare, there are so many stakeholders involved, including a particular subset of stakeholders, providers who don't like adopting new technologies very often. And so a really design-focused, human-centered approach that takes into account provider behavior, payer, regulatory environment, and ultimately that keeps the patient and population health at the center of innovation is key. And we've seen some incredible companies, like CityBlock Health most recently, which are taking on community-based healthcare through innovation, but also importantly through partnership. And I think that's ultimately the way to move the needle.
Yes.
Terrific examples. What I'll do is maybe instead of AI, I'll talk about what other thing is near and dear to my heart that I think has really helped reduce inequity, which is really telehealth and telemedicine, remote care. And this particular example isn't one that is your classic sort of video on a phone, but rather around being able to deliver medical expertise to rural parts of the world. There's a terrific organization called Pure, which is founded by Dr. Trish Henwood. And this, what the purpose of this organization is to actually connect experts in the United States with medical residents in, for example, Rwanda. And the goal is that, in order to do an ultrasound to diagnose individuals, ultrasound is not easy to do. You have like years of training, how to use the ultrasound itself and how to make the diagnosis. But if you can actually stream in real time, and there's a handheld ultrasound Philips makes called Lumify. And what we're able to do is the residents that are actually in Rwanda, in the University Hospital of Kigali, and what they do is when they see patients that they think needs ultrasound, but they are not trained, well, they're residents, but even so, they're not even trained in radiology and sonography. And so they actually will do ultrasound on the patient, and in real time, it's being streamed to the United States or in the UK. And there's actually a sort of a headset that tells them how to hold the ultrasound, how to go, where to see, and then to move back, move forward, and actually both provides coaching to the resident, but also, more importantly, is actually delivering an expertise from clear across the world, thousands of miles away, into a community, being able to elevate sort of the quality of care that they're getting, which otherwise would not be available. So I know people talk about telehealth mostly as sort of video visits and talking heads, but this idea of being able to, at the end of it, as an expert, instead of moving my atoms to Rwanda, I want to move my electrons to Rwanda. And so this is the idea. I think this is one of the things that is going to help reduce health inequity and disparities. That's just an example, which of course is a long distance. It could be across town, to be honest with you. But that is the kind of thing that I think will help reduce inequities. And that's the kind of thing we're leaning into.
Thank you, Shez. And you bring up Rwanda. One of the things that we are gathered here today to talk about is the environmental perspective and how that is having an effect on our health. And are there any new technologies emerging to help hospitals and communities and individuals so that we can mitigate the impact of harmful environmental outcomes that can have on health? And if so, which ones are you most optimistic about? And how might they be able to be implemented and used at scale?
Actually, my favorite example, not from Philips, and Deena may know about this one, is actually around a company that what is when a patient of asthma attacks, the technology determines sort of the local weather pattern, the temperature, pressure, the pollution index. And what it does is actually builds a machine learning model that helps a person when they get up in the morning to know if they're about to potentially have an asthma attack, because based on prior attacks, it's built a model that can understand the relationship. Now, so that's my favorite, but I want to tell you a little bit about what we're doing, but that to me is the example of using AI technology to look at impacting a person's life that is based on, for example, in this case, pollutants in the air. For us, one of the perspectives that we take at Philips is sort of the best way to get out of trouble, stay out of trouble. We'd like to figure out how to reduce pollution to begin with, so you don't need technology to defend against the pollution that you've made. And so for us, sustainability is huge. We have a whole mandate around sustainability, and our commitment is to have 25% of our revenue from circular economy, which means we source materials locally, so we manufacture locally and we recycle locally. The idea being is that if you don't move materials around across the world, you're reducing your pollution footprint. And so for us, that environmental sustainability is incredibly important. When we talk about innovation, we talk about the three sort of foundation innovation, which is accessible, affordable, and sustainable. So that's the kind of way in which we lean in to make sure that you hopefully have less pollutants to deal with, so that you don't need the kind of technology that actually have to help you manage pollutants in the air. Yeah,
absolutely. Thank you, Shez. Deena?
Yeah, I would just add to that I think certainly we have all as a globe and certainly those of us in the healthcare industry learned a lot from the pandemic. And one of the key, I think, learnings is around the interconnectedness of climate and our health, of the potential for those two things to really create effects that will last for generations. And in particular, for those of us that have lived in geographies where there have been wildfires in the last year, the combination of that and social distancing and the COVID pandemic and the zoonotic, or maybe not zoonotic, nature of the virus has really, I think, thrown a lot into question. And when you add to that some of the supply chain issues across manufacturing in and around healthcare, it is clear that we have a lot of work to do toward reducing the impact on the planet that will ultimately, not just for future generations, but for the way we breathe today and tomorrow, have a significant impact.
We do. Staying with you, Deena, because I know this is near and dear to your heart. Looking with a gender lens for a moment, what are you seeing in terms of advancements to medical care that will allow us to address the specific needs of women's health?
Yes, well, what I'm seeing is some optimism, and I'm proud to be a part of that through some of these milestone investments that we've had. But for too long, women's health has been relegated to a niche industry, which is mind-boggling. Not only considering women are 50% of the population, but also control 80% of the dollars in healthcare, and that women's health for many, particularly around maternal care and preconception care and pediatrics, is often the first intimate experience that a woman has with the healthcare industry. And it has been siloed, and it has been underinvested in, and it has been, as I said, relegated to niche. And that is changing. There are incredible entrepreneurs out there who have powered through years of being told that this is not a multi-billion-dollar business, and that are now building businesses that are ultimately going to change outcomes and help address some of the issues that Shez alluded to earlier on around the Black maternal health crisis in this country, which is a crisis around the mortality rate in the US, which is abominable even compared to global standards. And so I'm really proud of Kate and Maven and some of the other companies that have recently raised large rounds, and excited for what's more to come.
That's awesome. Thank you, Deena. Shez?
I'll add just a bit. I think, Philips, one of the things that we are focused also on health literacy, and so one of the applications that we have in the App Store, Pregnancy Plus, is #1 for maternity and has 40 million users. And we focus on how can we improve the literacy of individuals around whatever care condition. In this case, of course, is around pregnancy, but there's also a baby app, and there's a few other sort of solutions that we have around improving an individual's ability to manage their own life. It's just not, most of care, if you will, happens in between the doctor's visits, and you're trying to care for yourself. And a big part of that is health literacy. And so our goal with Pregnancy Plus is really to empower and activate women that are pregnant or thinking about getting pregnant or postpartum to be able to actually improve their self-care. So that's an example of where we're that gender lens that you talked about, and where we're working to help improve the lives of women.
And if I could just add one quick thing, because I think both of us were focusing on maternal health, but I just want to underscore, as I know we both believe, that women's health is more than just reproductive health, and that there is a big opportunity in early detection of hormonal conditions such as PCOS and endometriosis, and then of course also menopause, and then the mental health kind of connections to all of those. When we talk about women's health, it is more than just those reproductive years.
Wonderful. Thank you, Deena. Okay, last question before we close. Share with us one big prediction of the future of the delivery of care. Shez, I'm going to end with you.
I'm not even sure it's a prediction. It's probably everywhere, but I think it'll become the biggest thing. I think we're in a world where as individuals, our best experience anywhere is what we expect everywhere. And so the focus on experience is going to be an increasing part. We're going to apply AI, ML, machine learning to really help improve experience. Because quite frankly, most individuals assume quality. Now, I'm not saying it's there, but there's an assumption of quality. Nobody sort of goes to the doctor thinking, well, I wonder if I'm going to get good quality care. But we are thirsting for experience that's better than what we have today. And so I think there's going to be a widening of that sort of umbrella of how do we optimize, create frictionless experiences so that as you move between the points of care, you don't fall in silos and between cracks, and it feels seamless and effortless and connected. That's where I think a lot of energy is going to go.
Yeah. Wonderful. Deena, last word.
Yeah, I would say personalization of care. And so, the first wave was broader access, and that's excellent and very much needed. I think the next will be not only personalized medicine, but also, as Shez said, better quality. So it actually demonstrated ROI through technology, and to use that to deliver care and to diagnose better.
Wonderful. Thank you both for your time today.
No, it was our pleasure.
Thank you.
Thanks so much.